Hello, hi, this is Dr. Sham, and welcome again for another very exciting lecture that is about the heart murmurs. So, we're going to talk a little bit about how the murmurs are produced and then different murmurs in detail. So, how the murmurs are produced actually in the heart. So, in a normal, healthy heart, let me draw a left side of the heart, okay? Say, for example, that is the left side of the heart, and I'm going to draw the valves like this. That is your uh, aortic valve, and this one is your mitral valve. So that's just the left side of the heart. So it's going to be mitral valve here, and the tricuspid valve on this side. Tricuspid valve, and this is the mitral valve. So normal in a normal heart, as I said, opening of the valve doesn't produces any sound. It's actually the closure of the sound. We're going to discuss in a different video that how actually the heart sounds are produced. Here we're going to focus on the murmur. So opening of a valve doesn't produces a sound. It's actually the closure of the valve that produces S1, S2. If opening of the valve produces a sound, that is called click. Like in the metallic valves, we listen a click. And this is an additional sound. How murmurs are produced? The thing is that it is because of a basic principle of the physics. So in a normal valve, when the blood is flowing through that, it's a laminar flow. So if it's a laminar flow, no sound is produced. But in a stenotic valve, the flow is not laminar, it's turbulent. And this turbulent blood flow that produces a sound that is called murmur. Let's discuss about the different murmurs over here. Okay, how you gonna remember different murmurs? So we're gonna start it from a formula, okay? A mnemonic, you can say ARMS, arms. So you're gonna remember it from arms. Let's move forward. Just keep this one in your mind, and that's gonna help you remembering all the murmurs. So arms, here is our thing. So I have written over here AR and MS. So arms AR, it has early diastolic. It's an early diastolic murmur. Early diastolic murmur. And the MS, that's mitral stenosis, that is mid diastolic murmur. Okay, remember from this one. AR MS. AR has early diastolic murmur and MS has mid diastolic murmur. Now you know that the AR, okay, this is aortic regurgitation. That's something like aortic valve has got something to do with the second heart sound. What is the other valve that is involved in producing the second heart sound? Is a pulmonic valve. So it's aortic here, we're gonna write pulmonic, and regurgitation, it's the same thing. So pulmonary regurgitation also produces early diastolic murmur. Now, move towards the mitral stenosis. Okay, this is involved in producing the first heart sound. Okay, you know the S1, that's the first heart sound that is produced by the closure of mitral valve and tricuspid valve. Okay, and S2 is aortic valve and the pulmonic valve. So here we have the second part of that mnemonic, that is the mitral stenosis. So it's a mitral valve. So that's involved in producing first heart sound. This is how you're gonna remember. What's the other part of that one? Like, which is involved in producing the first heart sound. That is tricuspid valve. And it's stenosis. So I'm gonna write stenosis here. So mitral stenosis and the tricuspid stenosis both are the mid diastolic murmur. Okay, now let's move towards the other thing. So Aortic regurgitation. Let's write aortic stenosis. Okay, we know that the aortic stenosis that produces early systolic or ejection systolic murmur, actually. Okay, ejection systolic murmur. What's the other valve that's involved in producing the first heart sound? That's pulmonic. Yeah. So PS also, it causes early diastolic ejection systolic murmur, actually. Okay, and what we are left with, okay, MS we dealt over there, so it's MR. And if we are talking about the MR, so the other one which is involved in producing first heart sound is tricuspid valve, so TR. So these two produces pansystolic murmur. This is as easy as it is. So you start the thing from the arms, okay, and then you keep in your mind only the thing that which valves are producing the first heart sound and which are producing the second heart sound. Okay, so you get something from here, and then you need to remember only the aortic stenosis that produces ejection systolic. That's easy to remember, and the counterpart of that would be that is involved in producing the second heart sound is pulmonary valve. So pulmonary stenosis, and we're left with MRTR, and they produce the pansystolic murmurs. I think it's quite easy. Now let's talk finally about how you actually define a murmur when you listen to a murmur. How you define a murmur? So there are the certain things, okay, which you need to take into account while describing a murmur. So first of all, when you listen to a murmur, the first thing is grade. Okay, so there are the 6 grades: 1, 2, 3, 4, 5, 6. Depending upon how easily you listen the murmur and how loud they are, we actually classify into grade 1, 2, 3. Grade 1 is like it's difficult to listen even with the stethoscope in a quiet room, and the grade 6 is the murmur you can listen without even the stethoscope. That is grade 6. So first thing is grade. Okay, the second thing you're going to tell either it's a systolic or diastolic, early systolic or early diastolic murmur. That's the thing. Then you need to tell the area. It's best heard at the apex, like mitral stenosis and mitral regurgitation, aortic valve in second intercostal space on the right side, pulmonic on the left side. So area. The next thing is, okay, whether you are able to listen that murmur with a bell or a diaphragm. Okay, and then the next thing is when it is best heard, either during expiration or inspiration. The simple thing over that is that all left-sided murmurs, they become more prominent on expiration, and all right-sided murmurs, they become more prominent on inspirations. This means that the aortic and the mitral murmurs, they are more prominent on expiration, while the pulmonic and the tricuspid murmurs, they are more prominent on inspiration. So this is what you're going to define. And there are then two more things, okay, that is radiation. You know that the murmur of mitral regurgitation, the mitral stenosis, okay, mitral regurgitation, the murmur of mitral regurgitation that radiates towards axilla, and the murmur of aortic stenosis that radiates towards carotid. So in your description, you can add this thing. And then the last thing is that some of the murmurs, they are more prominent in a certain position, like mitral stenosis. The murmur of mitral stenosis is best heard in left lateral position, and the murmur of aortic regurgitation, that is when the patient is sitting and leaning forward. So how are you going to define a murmur? Let's see. Say, for example, if I have to define a murmur take an example of mitral regurgitation. Okay, so there is grade 3/6, whatever the grade is. Okay, mitral regurgitation. That's what I'm saying. So just keep that one in your mind. So there's grade 3/6 murmur, grade 3/6 pansystolic murmur. Okay, and where is that? In heard and at the mitral area. That's in the mitral area, isn't that? In at the apex, where the apex beat, you listen to the apex beat is. So there is 3/6 pansystolic murmur, best heard at the apex with the diaphragm. Okay, and in held expiration, as it's a left-sided murmur, so it's best heard in that side. In it's the best heard, and it potentiates actually. It's loudest in expiration. So there's grade 3/6 pansystolic murmur, best heard at the apex with the diaphragm during held expiration. Okay, radiating towards axilla. Okay, that's how you define a murmur. That's actually the complete description of a murmur. Okay, I mentioned here the bell and the diaphragm. The low pitch sounds, the low pitch murmurs, they are best heard with the bell. Okay, while the high pitch, they are best heard with the diaphragm. Low pitch sounds, which are low pitch sounds? It's third heart sound, fourth heart sound, and mitral stenosis murmur. They are low pitched, so they are best heard with the bell rather than the diaphragm. Okay, let's do another example of the aortic stenosis. So there is grade 4/6, whatever the grade is. Okay, we're talking about the aortic stenosis here. So there is grade 3/6 ejection systolic murmur, best heard at right second intercostal space. That's where the aortic area is, with the diaphragm in held expiration, because the left sided, so it's going to be more prominent on the expiration, radiating towards the carotid. Okay, that's how you define a murmur.